Production support for INFocus is provided by Smithville, a locally owned business serving central and southern Indiana since 1922, with residential and business internet, voice, and security services. Smithville, local pride, global technology. Information at smithville.net. And by viewers like you. Thank you.
Americans spend more on health care than on housing or food. Currently, the U.S. spends nearly $2.4 trillion on medical bills, hospital, and doctor visits. This amount is expected to double by 2017 if action is not taken. The Obama administration has set goals to have a health care reform bill from Congress by October of this year. But how does the president plan on tackling this task? And how does Indiana's health industry stand amidst the nation's? We'll discuss these issues tonight as we put health care in focus. Hi, I'm Ann Shea, and we welcome our WTIU viewers and WFIU listeners to our July show. Tonight, we're discussing the healthcare industry. We'd love to hear your thoughts by phone or email so we can address your concerns. Our in-studio experts are standing by, ready to answer your questions. Email us at infocus@indiana.edu or give us a call at 1-800-987-9848. The Obama administration recently passed the Recovery Act, designating $59 billion for health care in hopes of reforming and modernizing the industry. The act also invests $2.4 million into Indiana. In a report from Families USA, Indiana families spend more than 10% of their pre-tax income on health care costs. The report also shows that between 2007 and 2008, approximately 1.6 million Hoosiers were uninsured at some point, and the state ranked last among the 50 states in public health care funding. Here's more on how the Hoosier state is working to reform its health care plan.
One of the most challenging public areas for both state and federal governments is the healthcare industry, with 46 million Americans uninsured and the U.S. spending nearly $2.4 trillion, or 16% of the total national economy on healthcare. The Obama administration is working towards healthcare reform.
I don't think there's any question that we are going to have to provide basic health care to every citizen in this country, just like we provide basic education to every citizen in this country.
Basic health care reform may be helpful to the rising number of uninsured citizens.
Well, we have a lot of challenges, certainly in health care. Certainly covering the uninsured is, rises to the top. And so when you're looking at, millions of people without insurance, and that's a moving target too. Folks go into jobs, get insurance, then they're off and so forth. So, I think it's laudable that we're looking at ways to insure everyone, but it's not a silver bullet by any means.
Many doctors and medical facilities see the long-term financial and health care effects of the uninsured.
And it's a very sad and, frankly, for the United States, an embarrassing situation, or should be. They don't take care of their symptoms because they don't have the money. They can't afford the drugs that are used, for instance, to treat their hypertension. When you don't take your hypertension medication, eventually you will have a stroke.
Treating certain illnesses is often more expensive than preventing them. According to the United Health Rankings in 2008, Indiana ranked at the bottom for public health funding. Dr. Marion Broom thinks it's time to put health at the forefront.
I do think our state's leadership understands better than many people that the locus of good health lies with the individual. We have an enormously complex and sophisticated healthcare delivery system, but it's primarily geared towards treating illness, not promoting health.
Though Indiana has taken steps toward prevention awareness and health care treatment through innovative programs such as the Healthy Indiana Plan, there are still many low-income families who aren't covered. Both Broom and Monroe believe preventive care will improve the state of U.S. health care.
2 years ago, we increased the cigarette tax in Indiana, which we were overdue to do. And every penny of that revenue has gone into health, one way or another. I do think we need to get to the point, whatever that is, whether it's a government-run health insurance or whether it's a mix of public-private, which is really what we have now, but expanding that in a way to get everyone covered, that certainly is a big step forward from where we need to be.
Tonight, we discuss the issues, difficulties, and possible solutions for the industry as we put healthcare in focus.
And joining me tonight, as always, is WFIU News Director Stan Jastrzebski. Who will you be talking with tonight, Stan?
And we'll have two in-studio guests tonight. We'll talk about healthcare outside of Indiana's urban areas with the Lugar Center for Rural Health Director Emeritus. And we'll talk to a Bloomington woman who has had her struggles with healthcare even in a city such as this. That comes up later. Right now, back to you.
All right, thanks a lot, Stan. We'd like to start the discussion with the national healthcare industry and the Obama administration's plans to create affordable healthcare for all. In 2007, the U.S. spent approximately $2.2 trillion on healthcare, well over 10% of the total national economy. President Obama has dedicated $59 billion from the Recovery Act to the healthcare industry. Indiana, where 1.4 million people are spending over 10% of their pre-tax income on healthcare, is expected to receive $2.3 billion from the Recovery Act. Joining me tonight to discuss these issues are Dr. Nicole Kwan, Assistant Professor at the Indiana University School of Public and Environmental Affairs, specializing in health policy and health politics. Dr. Rob Stone of Bloomington Hospital and Director of the Hoosiers for a Common Sense Healthcare Plan, and Elizabeth Sturgeon, Executive Director from Volunteers in Medicine. Welcome to you all. Thanks for being here. Appreciate it. Let's talk with what everybody's talking about today, the fact that Senate Democrats decided not to vote on the Obama health care plan. They decided to postpone it until after the recess. Nicole, why don't we start with you? What do you think about that decision?
Well, I think it's a strategic decision to make sure that the plan that ultimately gets voted on is something that they have enough votes to pass. You know, there's some concerns from the public that this is all moving very fast. This is a very complex situation. Our system is complex. All of the different ideas that are floating around to fix the system are complex. And I think there's just a sense that we need a little bit more time to debate our options and think about the impacts of these decisions.
Do you think that this was basically a bad move? I mean, is President Obama going to not get what he wants to get pushed through, Dr. Stone?
Oh, I think it's way too soon to say that. I think that President Obama and the people who he works with and who advise him are brilliant politicians, and I think they understand that this process is going to take a little bit longer. So I'm not really discouraged in any way by today's decision.
Okay, I want to kind of just not overlook, but actually outline President Obama's healthcare plan, because I think that a lot of people are confused about it, and just highlight the main points of it. So Nicole, would you like to give us kind of an outline of it so that people can understand?
Sure. So I would say that President Obama is interested foremost in trying to help the millions of uninsured Americans right now. I think he has said many times that what he's interested in is having a plan under which nearly every American would be able to have basic, if not excellent, sort of comprehensive health insurance coverage. And I think coupled with that is a strong interest in doing things like cost containment and making sure that we have some systems and policies in place that sort of start to contain what people describe as our runaway healthcare costs.